everybody. My name is Erica. I am a travel occupational therapist. I'm also the owner-operator of The List live travel healthcare jobs website, where you can see jobs across agencies in live updated format and apply directly to the recruiters. Today, joining me is David Baker. He is an independent insurance broker, and David found me a couple of weeks ago. He reached out to me, said, "Hey, I do insurance for travel healthcare workers. Are you interested in this?" And I said, "Well, here are the problems. The problems are that when we get insured, we're either only licensed while we're only insured while we're on contract. And while we're on contract, one, we're in a different state. And two, we're too busy working to see healthcare providers. And we're also restarting our deductible every time we start with a new agency or new contract. And two, we can't be seen anywhere in the US." And he's like, that is not a problem. Actually, we can do both of those things, which if we're not friends, if you don't know me, this is something that I've been working on for the last 5 years, trying to figure out a good solution to this problem, which is us being able to be insured outside of our agencies and outside of the marketplace because of those limitations, which really are prohibitive of us getting healthcare. So David is here to tell us everything he knows and give us the inside scoop and tell us how to solve this problem. I'm so grateful that we have a solution to this problem now. Thank you, David, for being here.
Thank you. I mean, I appreciate you having us. That's an incredible one. You did so good. I don't even know what else I'm going to say.
Good. And that was everything we had to say. Thank you for watching us today. And we're done. And goodbye.
Not at all.
Okay. So let's start out. So for any healthcare travelers that are new, if you're a new traveler, you might not be aware of the current situation with us receiving healthcare. So to give you a brief synopsis of that, I'm going to just tell you about my struggles, and then David can tell you about the industry. I once was insured through the marketplace, and I'm a resident of Florida. And so I left Florida on a contract, and I was not covered outside of the state of Florida. So the entire 11 months out of the year that I was gone, I had no healthcare coverage, but I'm still paying for health insurance. And that is pretty true for the marketplace. I believe it depends on which state that you are a resident of, but I think it's very common that you aren't covered outside of the state that you're a resident of, which is we're travelers, we're not in the states we're residents of. And the other problem that we have is that if we sign a contract with an agency, agents say, "Hey, day 1, you can have insurance. Day 30, you can have insurance." And that's great, except that we are healthcare providers now working all hours that healthcare providers are working. So we, one, don't really have the time to go and get a dentist appointment, go and get a doctor's appointment, do all that. And two, historically for me, in the 5 years I've been traveling, it takes almost always about 3 months to get on to start with a new provider, to get a dentist appointment, to get a doctor's appointment. It's about a 3-month wait. And that's the length of our contracts. You finally get to see a doctor and it's been 3 months, you're probably already leaving. And if you have any kind of follow-up, you have to switch doctors again and start all over. So this has been a real headache. And I have been talking, amongst other travelers about the solutions. We hadn't really found a good one until David reached out to me a couple of weeks ago and he said, "Yes, I can fix both of those major problems that you have." So, David, do you want to tell us what it is typically, any issues that are typical, and what solutions that you have that specifically pertain to us travel healthcare workers?
Yeah, sure. I mean, you just named a good handful of them, right? I mean, and this is what the 3,000 plus travelers, medical travelers, people in the medical traveling profession that we help on a monthly basis do, right? Mm-hmm. They're dealing with the fact that the marketplace, which is healthcare.gov, right? Like Obamacare, right?
Right.
In almost 50 states, I think it's like 47 states, when you get insurance through the marketplace, you're only covered in that state, right?
Right.
And so you can't get it in all 50 states. So you need a nationwide PPO plan that, that we do offer. Like that's one of the things that we offer here in the private sector that I'm helping people out with. That's one of the things they love about it. What you said where, people, this happens all the time, right? Where people are on contract, right? You guys get a contract, but all of a sudden you got to wait for 30 days or 60 days when you're on this contract to even be covered under the benefit package the employer is providing anyways, right? Mm-hmm. So, and then all of a sudden 90 days in, you're covered. So you're only covered for 30 days of it, right? So what we're trying to provide and what we've tried to specialize in, especially with travelers, is providing the solution to these couple problems like that, where, hey, you're coming to the table on contract, off contract, in between contracts, like you're covered, right? You're covered with that. And that not only affects you, your body, your doctor's appointments, it also affects things down the road to future contracts. Because all of a sudden you have a future contract that it already has benefits covered in it, right? That recruiter comes to you with benefits included in the package from the employer. And so you come with benefits already, and all of a sudden you get a pay increase because, that benefit's already included. Now you have to ask for that. You have to negotiate that in, but that employer is already given, that hospital, whoever the end vendor is that you're working for, they've given that recruiter a package, right? And so not only does it keep you covered, it also gives you, some type of monetary benefit down the road as well.
That's a great point. And I actually hadn't even thought of that. But what David is saying is that, we have the whole pay package that's offered to us. And what's already deducted from that pay package is health insurance coverage. So if we go to the recruiter and we say, look, we don't need health insurance, we're not going to use it, we're already insured, take that out of what you're charging me and roll that money back into my paychecks. You're right, that totally offsets the cost of this. And I think even comparably, I think pricing wise, it's probably about the same if you were going to get insured through the agency or through here. But for sure, if you're insured outside of the agency, you're going to be covered for the whole year. And another thing that we didn't mention is that your deductible, if you're switching agencies throughout the year, your deductible starts over again completely. And especially if you start a contract in April, if you start a contract in October, you're working toward this, whatever it is, $2,000 deductible, and you're probably never going to get there. So it doesn't even matter if you had insurance anyway. So that's
Blue
another
Cross,
thing to think about.
Blue Cross Blue Shield doesn't accept United Healthcare deductibles. So you go from one company to another company. It's not like Blue Cross is like, well, they paid $1,000 to United. They don't care about that, right? So it's very true, right? It's what you're saying is true.
That's actually really funny. Okay, so talking about the cost, since we're already talking about it, can you give us a breakdown of, I know that, listen, this is why recruiters hate talking about pay packages or hate saying what a pay package would be as a blanket term, because they're like, well, taxes could be different and all of these variations. I'm like, no, just tell it to us. Just tell us and say it's a 20% tax. So can you give us some, I know that there's different levels of coverage that we could have. And there's also, if we're covering ourself and a partner and dependents. Can you give us a couple basic estimates on what it would cost? So if I wanted, say, the basic package or the basic package and the high package, just as a solo traveler, I think most travelers are solo independent travelers. So could you give us a guesstimate on what that would cost monthly, what it would cover, and what the deductible would be? Because I think a lot of times people don't pay attention to the deductible, but if it's $7,000, then who the hell cares? Why do you have insurance? You know what I mean?
Well, at that point, you have catastrophic insurance, which is nothing more than, hey, if you get in a car wreck, then you're covered, right?
Yeah.
So I'm going to answer the question, but then kind of give some background on the industry and what you might not even know this happens, right? But I'll answer your question first. First of all, it does base on age. Okay. That being said, most of the travelers that we deal with are, of course, going to be pretty much under 50, most of the time under 45 years old, right? Most of the time, just because you're traveling, you're going from contract to contract. A lot of times people who are older, they just tend to stay home, right? Or tend to get a job closer to their kids or whatever it might be. That being said, I think we ran this a while back, but your basic package for a good middle-aged person is going to start around $200 a month, and it can go up to $500 a month, right? The more you add to your package, the less liability you have, right? So you can add critical illness to your package where it covers you in the case of cancer, heart attack, stroke. It will cover your deductible. You can add accident protector. So if you slip and fall or whatever it is, you're working up north and you're not used to ice in the winter and you slip and fall on ice and you get hurt. Well, you have a deductible that has to be met, but this has an accident protector at the higher end of that range that will cover that for you, right? To where that's not a liability for it, right? Then, of course, you have your dental, your vision. All of those things are kind of supplemental and customizable, right? Which is one of the things that I really like about this, and most travelers like, is that it is customizable. You can change the deductible anywhere between $3,000 up to $10,000. That's on you. Like, you can choose a higher deductible if you really wanted to, and have a very low monthly payment, right? Have that catastrophic. If you want more coverage, like yourself, you can have a lower deductible and say, I'm going to pay a little bit more every month, but have a low deductible that in case something happens, I'm not necessarily out of pocket that much. So it's very customizable, but a good range is about 200 to 500, right? If you're adding families and kids, we've done families as low as 600, because if you chose the low plan for 200, your spouse is 200, and you got two kids at about $50 to $100 a piece, you're around 600. So we can do families around that point, and families, if you want the highest end, you can get up into the 1,000 as well, right? But what you'll find is your employer plan that they're offering you is also going to be $1,000 to $2,000, right? So it's very on par with what you're seeing, right? What your offer is, right? What I was going to say just a second ago about your recruiter, and this is kind of a key. I don't know, some of your younger travelers might not know this. That employer, your hospital, your employer goes to your recruiter and says, here's $6,000, right? And then the recruiter says, okay, well, here's $5,000 for your pay, and this extra 1,000 is for your benefits. Okay. Well, the employer is mandated to pay 50% of your healthcare benefits. That's federal. Like, they have to do that. Okay. So let's say you pick a plan that's $1,000. Okay. Well, they're going to deduct the 500 out, and then of your check, and then they're going to pay for the other 500 because they're mandated to pay that 1,000 or that 50%.
Okay.
So what happens to the other 500 is, what many people don't know is the recruiter then turns around and takes that as profit, or the recruiting agency can take that as profit, because the employer is just saying, hey, here's the package that I'm offering you. You go and get the people that you need, right? So that's kind of a side thing that many people don't recognize, and that's where you can get that extra income negotiated in as well. Okay,
so I didn't realize employers have to pay 50% of your insurance benefits. So whatever it is that they would be paying, we can ask them to just roll that into our pay package because we're going to be doing our own private insurance.
Yes.
Cool.
Yeah. Yeah.
Good to know.
You
Good
have
to
to be a
know.
little sneaky with it. You can't just be like, oh, I'm coming with health with more coverage. And then they'll be like, well, the benefits aren't included. Like they can just kind of take that off, right? So get the whole package. What is everything included, right, on your contract? And then say, hey, you're already giving this for benefits. I already have a coverage. Just get the number for what they're paying for coverage first, though. But yeah, I mean, we have travelers do it all the time.
He's good, you guys. He's obviously he's obviously working in the industry. That's what we always say, like have them give you the whole breakdown and then you negotiate from that. You start with them giving you all the numbers and then you say, okay, this is what we're going to do with this. He's on to it. He's on to him. I love that.
Crazy competitive. So know your value for sure. You know, they want contracts. And if that's going to give them a contract to add an extra $500 or whatever it is into your paycheck, instead of having the employer cover that benefit, they're going to give you that extra money because they don't want you to go to another contractor or another recruiter that will do that. So,
right. Of course. Something I want to point out, and this is just my personal experience. I wonder what everyone else's experiences have been. I was insured through the marketplace, Obamacare, whatever you want to call it. Maybe 3 years ago or something, I tried it. And I think I paid, like $450 a month. There was something like that. And I wasn't covered outside of Florida. So it did me virtually no good. I think I had some like main, standard visits included, but again, it was impossible to have the time to do that and to get on someone's wait list. So I don't really even think I used it. I went back this last year, the last time it opened in October, probably. And you put in your income, our taxable income is super low. As you know, it's about $20 an hour is all that we're reporting as taxable income. So our income that we report on that is super low. And even then, this last time that I looked at doing it, it was like $850 for the cheapest plan. And the deductibles were insane. Like it was crazy expensive and it was still not going to be applicable to me. I mean, I don't even think I've been in Florida this year. Like in the last year, how much time have I spent in Florida? Like maybe 4 weeks. So that is something that I noticed, and I don't know what caused it to skyrocket like that. I don't know if it happened for everybody. I would assume that it did, but that was my experience to where that is no longer even like feasible. I'm not really sure what happened over there, but it was crazy expensive and still just not applicable to anything that I needed. So this being $200 to $500 a month, that is a great price for insurance if it's good insurance. So that's something else I want to ask you, David, is it good insurance? Like who is the insurance through? Who would these providers be that we would be insured through?
Sure. It depends on the state, right? But they are top end providers like United Healthcare. So United Healthcare is probably the biggest one I deal with, and they're 96% of all doctors are in United Healthcare's network. And Cigna in some states, PHCS in some states, First Care in a very few select states because they're smaller. They're smaller anyways. They are good, but they are smaller, right? So those are the 4 main ones I deal with, right?
So I have a question. When you say it depends on the state, what do you mean? If we're all over the country and we don't know where we're going to end up, what do you mean it depends on the state, like the state that we're a resident of, or What do you mean?
It depends on the home state because it depends on who I'm brokered with as the independent agent in that state.
Okay.
Sometimes I got United Healthcare in some states and I have Cigna in some states, but everything's going to be based out of your home state.
Okay, so the insurance provider that we would be placed through depends on our home state, but it doesn't affect where we can be treated. We can still be treated anywhere in the country. Is that right?
Correct. And be considered in network with that provider. That's the important, right? Technically, you can be treated anywhere, but for many, even on marketplace plans. But you're not considered in network, so your cost skyrockets. Right. So what the important part is, you can be, let's say you're in Florida. I know I deal with United Healthcare in Florida, right? So any place in the country that accepts United Healthcare, you're considered a network. You're in, is it Nevada now? Oh no, I've talked to you like 3 times.
I know. I'm probably every time we talk, you're like, oh, I don't know where you are. I'm in Reno.
Where are you now?
Nevada right now. I am in Nevada. Why? We don't know. I'm not even on contract here. I don't know why I'm here. I just stopped along the way trying to get home, and I was just too busy to keep driving. That's the honest truth.
So anywhere that is in Nevada that accepts United Healthcare, you're covered, right? I know I deal with Cigna in North Carolina, right? So if your home state's North Carolina, well, you'll be on a Cigna plan, but anywhere that accepts Cigna in the United States, you're going to be covered in network, right?
Okay.
You're going to get network pricing.
Okay, perfect. That's what we wanted to know. Another thing that you said that I want to make sure travelers know, I'm not sure how many of us know this. I certainly didn't until I started digging into all this, but you said it's a PPO, and I know that a PPO is better than an HMO and other things. Can you tell us the difference and what that means and why it's important?
Yeah. And we're going to make this as fun as possible.
Oh God. Okay. Yeah. I had this conversation with David. I was like, okay, insurance is super boring. We have to make it as fun as possible. I hope you guys are having fun. I hope if nothing else, you're like, yes, cheap insurance. It's actually going to work. I'm so excited because that's how I feel. Hopefully you guys feel the same way. Okay. HMOs, go.
Right. HMOs are like trying to think of a really funny analogy. I'm just not necessarily a funny guy. So, but HMOs, you have to, they're zip code restrictive, right? So you can only get the HMO in network pricing where you live, right?
Okay.
They also require referrals, right? So if you want to go see a specialist, right, then you have to get to your primary care, pay that copay, pay that bill to get a referral to go to your specialist, right?
And mind you, on this topic, just so we understand, this totally killed me when I had this. Not only do you have to pay the copay from your primary care. One, you have to get assigned to a primary care. Two, you have to get established in primary care, which will probably take you 3 months. Three, once you get to that appointment and you say, hey, I need this, then they refer you to a specialist. You have to get established with that specialist. So they have to be taking patients, and then you have to wait those 3 months to see them because they're full and booked out 3 months almost always. So you're 6 months at best out from getting whatever it is that you needed done. That is my nightmare story with an HMO, and especially doing it across cities when you're trying to plan 6 months ahead. Where am I going to be? And I'm going to need to keep seeing that person for an extended period of time. Where will I be in 6 months and for the next year? Like, it's a nightmare for travelers, just so you know. Don't have an HMO. Okay, back to you.
Yeah, that's a great explanation. I couldn't have said it better. PPOs are just nationwide plans, no referrals. Most of the time, PPOs will cost more, right? Just ironically, whenever you're getting it through the private healthcare, sector and not through the marketplace, it doesn't cost more. It actually costs less, right? So PPOs are the way to go, especially for all the travelers out there. If you're on a HMO, you're just throwing money down the drain in general, right? Unless you're just contracted in your state and you're not going outside of your state, and then even then I'd say I probably could still save you money, right?
Yeah, that's a good point. I'm glad that we talked about the difference in those because I forgot about that.
Yeah, it can be a
nightmare that is an HMO.
Yeah, it can be a disaster, and they're not, gosh, I hate putting things down. I try to be unbiased. There are places for HMOs, right? Sometimes, you might have that senior adult who needs, they never travel outside their city, right? And that's a great thing for them, right? They can get a guaranteed insured plan. They can use those, but for travelers, it's throwing money down the drain. So.
Right. It's very difficult for us specifically
Yeah.
because of our traveling. If we're in one place and we had time to wait, then it could be workable, but it's almost certainly not workable for us in our lifestyle. So do you have anything else that you wanted to add? Any other points you wanted to tell us that we're maybe not thinking about, or anything to consider before I tell them how they can get a hold of you?
No, I think it's good. I think we covered a lot of stuff with it. And, I think in general, the biggest thing is just to know that, I'm going to tell you, even if there's some things, within the scope of what you're looking for, if I can do it, I can do it. If I can't, I can't. I'm going to tell you that, right? There are not many things that come up where I can't do anything for you, right? But if I can't, I also know people who can. So, there's an option out there for everybody. And what I've found is that the best customer service you can give is to be factual, tell the truth. And, that means you can garner some more business. That's the best. And if I can't, that's going to give me a better reputation in the back end for telling people, hey, like, you need to see this person because I might not be able to help you in that particular situation, right? But out of most travelers, and this is the people we're talking to, there's hardly any travelers that I face that we can't help, right? I have some people, I say that because I've had travelers say, oh, this is great. Can you look at plans for so-and-so? And they're not a traveler, and it might not be the best plan for them, right?
Okay.
But for my parents or for my brother or whatever it might be. And I want to be there to help everybody, but I'm also going to be honest if I can, right? So
Okay. Okay. Perfect.
I'm sure I enjoy the time. Thank you for having me.
Yeah, perfect. Well, we appreciate it. We appreciate your time, and one, like your expertise on the field, but two, just having this option for us finally. Like, I'm sure it has existed. It almost certainly has, but I truly, 5 years, I've not been able to find someone that says yes. I've asked so many insurance brokers and they've all said, like, no, it's by state. You're not going to find what you're looking for. So when David contacted me, I was like, oh my gosh, yeah, wait, come, I need you to do a video for us travelers. Like, tell everyone what you're telling me is like a gold mine. It's how it feels. So if you're interested in talking to David more about getting health insurance, he said the best way to contact him is just texting his cell phone. So I'm going to post his cell phone number below this video. You can reach out to him directly and ask any questions. And if you want to find out about getting insured through him, you can. David, thank you again so much for your time. Thank you for this helpful info. We really appreciate it. And yeah, thanks for being here.
Thank you.